Hi, everybody, and thank you so much for taking the time today, because I know it is a super busy time for all of us. I mean, I guess it has been for the past 18 months. But I wanted to start, we kind of had a loose agenda. We wanted to please use your chat for sure, because if you have questions as we bring things up, that way too, we can ask you to unmute yourself. But we really wanted to touch some hot topics. I mean, first, of course, we wanted to see how everybody was doing in regards to mandatory vaccinations. We wanted to touch base about exemptions and waivers. So if anybody has any questions about those, if you want to start typing that in the chat, that would be great. I do want to let everyone know that if you haven't already, we do need to let the health department know when our booster vaccination clinic is going to be. And we need to email them that information, and I'll type that in the chat here in a second when we're doing more of a question answer type of situation. So make sure that you get together with CVS, Walgreens, Good Day Pharmacy, whatever pharmacy you're going to use for your COVID booster vaccination clinic for your staff and your clients, and that you get that scheduled, and then you contact the health department regarding that. So definitely that we want to talk about the mandatory vaccinations. We'd also like to know data, how many open positions you guys have, and how many staff, unfortunately, you possibly lost last week because of the mandate. So if you guys wouldn't mind sharing that information with us in the chat. And then also wanted to give everyone a much kind of hopeful perspective if you're a Medicaid provider. So I don't see anything in the chat yet. So I will go ahead and start with the good news for Medicaid. So I did speak with HICPUF today, and as you know, they all sent us out an email September 24th. It had a lot of information in it, and a lot of it didn't really have to do with ACF. But when I really picked through that, it has been decided that all Medicaid providers are going to receive 2.11% increase. That is going to be retro. And it's going to be retro back to April of 2021, but I will have to pull that document up and relook at that. And it has been approved through 2023. The other piece that, of course, we're going to be able to get is the pass-through, and we're not exactly quite sure how that's going to work. That wasn't really dictated in that last email. So I did reach out to Colin and the individuals over at HICPUF, and they did say that a week from Friday, we all should be getting an email to further let us know how and when we can start billing for the 2.11% and how they come up with 2.11%. I'm sure it's something strategic. But the 2.11%, and then it's also going to dictate how this whole pass through for the increase in minimum wage to $50 is going to be. So with those kind of being the frameworks of things we wanted to discuss first, does anybody have any comments? Anybody want to open their mic and let us know about their struggles or their successes? I do know Janelle and Rachel and Janet and myself worked really hard. Well, they worked really hard to make sure that we had a really good framework for a policy and procedure and religious exemptions online. So if you are still looking for those types of things and you're a CALA member, that is available on the members only portion of CALA. And you could sign up today and be a member of CALA and still have access to all that information if need be. So I'm going to kind of turn it over to all of you and let us know what we can do.
As I'll bring it up with the staffing issue. That's a big topic, hot topic for us in the industry right now, and I think in anybody who's an employer. Has anybody reached out to the state to see if there's any? They keep posting that they want to help us with some extra support, but has anybody been able to to get any support from the state at this point.
This is Maggie. I put in a request yesterday morning and have not heard a word from anybody.
Good. I'm glad I'm going to probably put in a request here this week too.
I got a phone call saying that they're prepared to have National Guard nurses help us out with staffing.
Did you request that?
No, they actually called and were being proactive, asking about how the vaccination mandate was going to impact us. And I said it wasn't impacting us because we're accepting religious exemptions. But I think probably everyone foresees that that's going to be taken away eventually, I think. So
Mandy, I got that same phone call. Is that because you guys have so many people that are not vaccinated?
probably.
Okay, because I asked them, because I kept forwarding comments I had reached out to several people to answer those. There was some questions that they posed to us as far as how that would affect us. And she reached out and said, this is really for people who had reported on the EMR resource that they had just quite a few people not vaccinated at this point.
Yeah.
So, well, I hope I get that same phone call, Mandy.
It's interesting because I put down that I was in desperate need. I needed it yesterday and still haven't gotten a phone call. So that's very weird that they're calling people randomly.
Thanks. And Rachel, this is Representative Donald Valdez. I was wondering if you guys can, when you do email the state, can you add me to that thread also and see if what we get replied back from and see how I can help you moving forward?
What is your email? I can forward what I sent yesterday.
It's donald.valdez.house@state.co.us. I can add it in the chat too.
Okay, great. Thank you.
Has anybody sent out their waivers and got any rejections or exceptions? I do know of one person that sent out and they got rejected and then they resubmit it and they told them it could take up to 60 days before they'll let them know if they approve the waiver or not. So that's really concerning to me. I mean, even if it's going to take 30 days to see if they accept the waiver, what are we supposed to do with the employees that we submitted the waiver for? Because it was my understanding we were not supposed to keep them while we were waiting the outcome of the waiver. Is that correct? Am I understanding that correctly?
No, so basically we need to submit our waivers and make sure that you've got your policy and procedure in regards to your accepting religious and medical exemptions, and to make sure that you have the appropriate document, whether it's the religious exemption form that you had those wanting an approval from you that you've accepted that religious exemption, or the medical exemption signed by the appropriate people, or proof of vaccination in the employee's file. And then you can go on with your testing and your PPE or whatever guidelines you put in your policy and procedure to keep people safe, because you have unvaccinated staff. And we move forward with unvaccinated staff that have exemptions till they respond in the waiver. And then if for some reason they refuse our waiver at that time, then I guess we either comply with changing whatever they're asking us to change, or we have to let those people go. But I was told during the subject matter meeting that they literally were going to look for a good solid policy and procedure, make sure that we had the exemptions appropriately, and we were doing good PPE testing and screening. And that from what I heard from the health department, it sounds like our waivers should be approved.
So we can keep the employees that we're waiting for the waivers on if we have not gotten an answer.
Yeah, as long as you have all the documentation and the policy and procedure. I know ours got rejected because I electronically signed it. And apparently I had to do a real signature. So I signed them authentically and then I sent it in, and I haven't heard anything since. I know my other concern and question that I'm hearing is people that have multiple locations. I applied for waivers at 3 of my locations. Well, if I have to move staff around at all, I didn't apply for a waiver at all 5 locations. So, and I know some other people that have that question too. And I emailed the state and I haven't heard back any answers regarding that either right now.
Does anybody know what's happening? I had somebody who didn't get their waiver. I know they were supposed to be, everything was supposed to be submitted by last week. They didn't get their waivers in until this week. Do we know what any of the repercussions are of late waivers?
That's a good state question when you guys meet with the state.
Well, and I wondered, because Millbrook sold on the 1st, I filed the waiver on the 30th, but I asked them if the new owner had to file the waiver on the 1st because it's different companies. And they didn't have an answer for me on that either.
Okay.
Does anybody else have anything in regards to questions on the mandatory vaccinations, exemptions, waivers, or the booster shot clinics?
Hi, my name is Michael with Master's Touch. Was the exemption, I have one employee that brought a paperwork for religious exemption. Is there any protocol or like a requirement that needs to be listed on the document? It has the church letterhead and everything and what they believe in and all of that listed in there. But is there any wording that the state requires on that letter?
That's all going to depend on the policy and procedure that Master Touch has decided to initiate for your own personal company. So, I mean, if your policy and procedure reflects that, you know, the religious exemptions must come on a letterhead and explain that, you know, the individual's beliefs, and if that's acceptable to you, then, you know, and you have a policy and procedure that support it, what we're hearing right now is that that would be acceptable. We did hear directly from the department that they're not going to go in and like vet these religious waivers.
Okay. And also, do we have to personally contact the church and ask them anything, or is the letter sufficient?
The letter should be sufficient. Unless you have in your policy that you're going to contact the church, then you would have to follow your policy. But you don't, if you don't have that in your policy, then no, you don't.
Okay. Sounds good. Thank you so much.
Thank you. Do we have
anybody who's
And
really
I would like to be,
oh,
sorry.
No, that's okay. Michael, go ahead.
So I just wanted to be added to your list and figure out a way to be a member. Basically, we purchased this facility from Priscilla this year in June, and she has been sending me emails, and she has been forwarding me some information that are coming out of you.
Excellent. We will definitely do that. Thank you so much, Michael. Do you want to type your email in the chat and we'll make sure to get you information and we'll follow up? Or if you're on the phone, that's okay too. We'll figure out how to get a hold of you.
Yes, I will. I will give you my information. I'm kind of driving towards my kids' school, but yeah, I will send out as soon as I stop. I will send out my information.
Excellent. Thank you so much.
Thank you.
Just reiterating to you know, everybody who's on here, if you are a CALA member, you do have access to the policy and procedure and the waiver that we did put together as a added benefit for our members. It just gives you, we want to pull incentives for people who have joined the organization and give them tools that will be useful for any of you.
Does anybody know if the booster is mandatory for staff?
It is. It's under the brand new, the public health order. So the booster is mandatory for employees that were vaccinated. Currently for just Pfizer though. So if you were vaccinated originally with Pfizer, then you should be getting the booster. And then with, if Moderna or Johnson & Johnson ever get to that point as well, then the public health order said that employees must be compliant with all requested follow-up booster vaccinations.
Do you know when the state will be contacting us to set up those booster clinics?
So we are supposed to reach out to do that. I do know that if you have someone that you can, that you've contracted with in the past, like I know Good Day Pharmacy is coming out to do ours, but I think that there was a link. I have that email that I'm going to type in the chat, and I'll do it right now. And you can contact them if you need assistance having your communities vaccinated by the state. Let's see.
Well, we
So
were
I'll
on the
put that in
Bloom.
chat.
We were on
Go
the
ahead.
Bloom Healthcare list for a clinic, and then they said they couldn't do it, and that the state would be reaching out. And I wondered how long that's going to take. If you'd heard anything.
I think we need to contact the state. I don't think they're going to contact us. I did type the email address into the chat so you can contact them. I do know, do you contract with a pharmacy that delivers your cycle?
Yes, we do.
Excellent. I would start by calling them because I know a lot of these pharmacies are coming out and doing the booster and flu shot clinics actually on site for your clients and staff if they would like.
CVS.
Thank you.
CVS,
Yeah, of course.
I know I've been contacted. I think several of us have already been contacted and we've already started our clinics. So just a heads up that it is happening right now.
CVS and Walgreens are reaching out pretty aggressively. So if you just contact them,
Oh, we lost you, Dennis. Here you are.
Does anybody have a specific person? I know Leslie, and I don't know if that's Northern Colorado, but Leslie was a contact that I received last week, and she came to our house already yesterday to assess the area to give it on Monday. Does anybody recognize that name? I would be happy to share her number because if she doesn't if she's not the contact, she would let you know who the best contact is in your area. So I will put her information on in the chat for anybody who wants to reach out to her on the clinic.
who is she with?
I don't know if she gave a name specifically. Who was she with? CDPHE. So I'll put her name in there.
And Dennis, I just put on the chat that Alpine Pharmacy is doing boosters, even if you don't contract with them. They were doing them, as far as I know, even if you don't contract with them as your pharmacy of choice through your facility.
And I know Good Day said they were going to do the same.
Thank you.
Good. How are you?
Good. Jen, about here?
Hey, Nicole, have you been in contact with the state regarding the booster? I know I heard you mention that the third or the booster is required, but in the Chapter 2 proposed, which then became a temporary rule, it specifically addresses the ACIP and not FDA. And at this point, the ACIP hasn't recommended a third dose.
Yeah, I think that in the temporary rule, that's what it said, but then the health department came through and said that the final rule and the proposed change was that it was also going to be following the CDC. So I know that we literally had a date of 10/15 that we were all supposed to contact the state and let them know when our clinic was going to take place for the boosters of Pfizer. So I would just expect to hear from them. Or you can reach out to them with that question, because I have that question as well, because I have staff that really do want to wait for it to be 100% approved through that entity. And since it isn't yet, they're kind of wanting to wait. So I emailed them that question as well. The other thing is we are hearing that people after the booster shots do get kind of ill a lot more, have some flu-like symptoms and aren't able to work. So I also reached out to the state and let them know that it's very possible that people again are going to need to stagger booster vaccinations, because we can't have all of our staff out because they all feel horrible after the booster, and we can't increase our staffing needs right now with a whole bunch of sick residents. If the booster is making people feel kind of horrible. So.
And
Maggie?
to let the state know that we are scheduled, we already scheduled ours on the 11th. What is the email address? We are still in transition and we are not getting.
So I know the email address is cdphe_COVID-vax@state.co.
If you don't mind, you kind of cut off there. If you don't mind putting it on the chat.
Oh, I did. I can redo it too. Yeah.
It's in the chat, Michael.
Yeah, I'll put it lower down now so you can see it easier too. There you go.
Is anybody getting pushback about the booster with their staff?
Yes. They're wondering when it stops. Are we going to stop at 8 boosters or, 5? Or I didn't have an answer for them.
I have one QMM manager who says she's still not feeling good from a vaccine she got back in February of last year. But, we require a flu vaccine every year. So I don't know how this is different. I've already gotten my booster and I had no effect. So thankfully.
Well, I think it's different because it's not been around for 40 years. So I think there's a lot of people that have questions about it, and most of my staff are included.
Yeah.
Any other questions regarding mandatory vaccinations, exemptions, and waivers? Did anybody lose staff? I mean, we really are, I'm trying to give accurate numbers to the health department regarding, I know there's a lot of reasons we're in a staffing crisis, but if there is something specific that you guys would like us to share, because Janelle and I, though we won't be meeting via Zoom with them tomorrow morning, they have agreed to let us submit questions to them. They have been very timely in getting back with Janelle and I and very supportive. So if there's questions on this or anything else that you would like us to ask Dee, Elaine, Cheryl, and Peter, please also feel free to unmute yourself or put it in the chat, because Janelle and I are getting all of our questions put together for that email that we're going to send to them.
Nicole, I have a staff member that's embarrassed because I only have 2 staff working one house. So when I filled out the waiver, I put 50% vaccinated. So that clearly tells the families that can read that waiver that one got vaccinated and one didn't. And she's feeling like families are going to harass her. So
And this is Maggie.
Yeah. It's how I feel. I feel like we have the scarlet letter on our door because we're not 100% vaccinated. I don't know how anybody else feels about that, but I'm like, it's that whole hate-love relationship, and it's like, I don't know.
Wear it with pride.
I will. Thank you, Dennis. I appreciate the encouragement.
Maggie, what was it that you were saying?
I was just going to say that I'm not having an issue finding staff that are vaccinated or unvaccinated. I'm having an issue finding staff, period. And especially this year, I'm paying almost double what I paid last year. I'm a Medicaid only facility and a 2.11% increase just doesn't get it. So this is a big concern for me. And I understand that there are more and more Medicaid facilities that are thinking of closing because they can't keep their doors open. When you're paying $22 an hour for a cook that last year I was able to get for $10, that's awful.
Well, and aren't you, are you in the Denver area, Maggie?
I am.
Oh, man. So the minimum you have to pay is 15 right now, right?
Yeah, that's the minimum. But I can't even get anybody under 20.
Yeah.
For QMAP, I have a QMAP advertised right now for 25.
Wow.
Yeah, Maggie, I'm a pretty much 100% Medicaid as well. I don't understand what HICPUF doesn't understand. This thing, it can't go on. It can't sustain itself. My real estate taxes have gone up 100% in the last 2 years. Add on to that the food costs, utility costs, and of course the insane labor costs. And then I get billed for that $80 to make me legal to do self-testing with our staff, and $500 to the fire department to do their annual reviews. I mean, I don't understand where they think this money comes from, but there it is absolutely not sustainable. And I have warned them for years that they are going to lose all their Medicaid beds and have a.
Dennis, you're on mute.
Let's do it again.
Well, I think we're gonna have more of a homeless crisis. I mean, where are these people gonna go? I mean, there's no place for them to go if they can't, if we can't sustain these Medicaid homes. And I don't know what's going on, but I do know that probably in the last 6 months, I know 7 mom and pop operations that have sold. And they have sold to people that are investors. They have sold to people that are buying 5 and 6 homes. And I don't know what I'm not seeing, where they're seeing money to be made in these Medicaid homes, because there is no money. So I don't know. I just see a lot of the mom and pops, they're just going out of business. I mean, you just can't sustain. There's just no way to sustain. And I guess corporate America sees something we don't. I've been told that maybe it's because they're going to add on and have more rooms and they're going to make more money, but they have to have money to run their operations. So I don't know where, maybe it's a write-off. It's just strange to me, but my concern is that the residents there are going to end up homeless. They have nowhere to go. There isn't going to be any room in the nursing homes because of the staffing shortages. So, I mean, there's only so many nursing homes that take Medicaid anyway. Then you get the staffing shortages and they're cutting off different wings and they're not going to take them either. So they're going to end up on the streets, and who's going to take care of them and how are we going to pay for them?
I do recommend, because for what reason, I'm not sure. I do find it very interesting that Senator Mr. Gonzalez was just on our meeting, or Valdez, pardon me. I mean, he was just on our meeting. I really think it's important that we all copy that state email. Anybody and everybody that has concerns, just not about HICPUF or anything else going on. I mean, he said he was really interested in knowing. I think we need to not stop being the squeaky wheel. I know it hasn't done much for us, but a 2.11% increase, but we need to start contacting our local representatives, our senators. We need to make sure that, we're emailing Joint Budget Committee, that we're all continuing to email HICPUF. I mean, trust me, we all felt like it was a complete punch in the gut when we heard that people at the Capitol and at HICPUF were so excited to announce a $15 minimum wage pass-through for Medicaid providers to make sure and ensure their employees receive $15 an hour. And like Maggie said, most of us in the Denver metro area aren't even able to hire a caregiver for under $18, $19, $20 an hour. I do think it's great for the rural areas. I mean, I really hope that this gives them the support that they need. But I agree 100% with Janelle. I think we need to let them know we're concerned about a homeless, increase in homeless population and those that are most at risk. We need to continue to speak out. I don't know if it's going to change anything, but I think we still have to try.
Well, and I looked on the participants, and it looks like Representative Valdez is no longer on, because I thought he could hear this, but.
He did say that he had to jump off for another meeting, unfortunately, but he did, when he messaged me, he said, please, 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 I want to know how I can help. Please encourage people to reach out to me. I want to learn more and I want to know how to help.
Okay, I will definitely send him email.
I think that's a really, really good idea.
Nicole, I have a question about it, and like, I don't know if anyone knows the answer to this, but I'm just trying to figure it out myself. With the National Guard nurses, which I think it's a bizarre suggestion, frankly, for us. We're behavioral through and through. There's nothing medical about what we do. And so I think to suggest that the government's just going to throw some people into our homes is insane. But I am wondering, how does that work? Because then they're essentially our employees that we did not hire or train, and how do they get paid? And does anyone know how all of that works?
So to our understanding, we do not pay them. However, you do need to put them through an orientation that's similar to the orientation that you would provide if you contracted with a temporary staff company, a staffing company. I do think that's something we need to ask more questions. I had the National Guard come out and help me during a COVID outbreak, well-ish, that we had over the holidays. And we gave them a preliminary orientation. We did not pay them. We did not have an employee file. We did not have to run a background check. However, the individuals that I had were only able to basically cook, clean, and kind of watch the clients when my QMAP or my skilled caregiver was off doing things. They weren't skilled. So I do think that we can, and they were really helpful when they did place they placed 2 guardsmen with us and kind of said, okay, this is exactly what we need you to do. And they did make it very easy. So I do know it's free, and I do know we don't have to worry about background checks, TB tests, or anything like that. We just have to do that preliminary orientation and document that we did it.
Okay.
And I also had them last year, and I had QMAPs that we did the same thing as Nicole. We did an orientation. We watched them pass the meds and had our numbers readily available. If they had any questions, we said, do not, hesitate to call us. But we also did not pay for them. But they were very good. We have cameras in our medication room, and we watched them, and they did very good.
Well, that's good. I wonder like how they're going to do with somebody acting out aggressively or, eloping. I don't know. There's all kinds of things that go on in our houses. So that's one of my concerns. And then I had also heard that they don't actually, their vaccine mandate does not go into effect until June of 2022. So I don't know how that works, or if they would just put vaccinated people in, because otherwise it seems counterintuitive to put unvaccinated people in because people are unvaccinated.
Mandy, this is Janet Cornell. I did ask that question. You are responsible to train them so they can handle those behaviors, because my homes are dementia and we have behavior problems too. So I asked that question, and they did say, well, it's your responsibility to train according to the population that you serve.
Okay.
What they basically said to me because we didn't get QMAPs, but if you were to get a QMAP, it was good if you did have someone that kind of knew the population and the care plans, so maybe one of your locations that if you do need to staff on during the day, and that's kind of, I restaffed to kind of try and make sure that happened. I do think, however, they are nurses. So they did receive training in mental health, just like every other nurse. And behaviors and redirection. So hopefully the concept isn't completely foreign to them. Because if they really are LPNs or RNs, that's part of their education. It's just hard with the specific care plans that all of us, whether it's dementia or it's very, very, very hard to put one person in charge of 8 people that they've never met before.
Right.
Well, and I think for all of us, it takes time. I mean, those residents, they learn to know who we are as people and caregivers, and I get it, takes time. And I mean, hopefully whoever you get, they will be there a while until you don't, utilize it as long as you can, at least. I did have a question going back to Jason's comments about the all employees direct contractors. So going back to your comment, Mandy, a minute ago about them not being mandated to vaccine, technically they're an outside contractor, not contract. I guess they would be contracted with the state, not necessarily us then. And I'm assuming that's the reason why we get around that.
Doesn't that seem ludicrous that the reason you're using them is that you don't have staff that are vaccinated?
Right.
Isn't that kind of like, well, then I can use your staff
That's a
that's
good
also not vaccinated? I mean, there's something wrong with that on all levels.
However, Janelle and I did bring this up, I believe, maybe in an indirect question. And I know they led us to believe that they thought that these individuals were going to have to be vaccinated because they agreed that would be kind of a silly thing. So that is one of the questions I've written down to talk to the health department about and email them, hey, we want to make sure all these National Guard and individuals you're bringing in to cover for us and our staff or staffing shortages are vaccinated, or what are we even doing here? I'll definitely include that. Mm-hmm.
When you talk to them, would you also ask them what the turnaround time is from the time you put in a request to when they get back to you? Because for me, it was yesterday morning, so it's been almost 2 business days.
Mm-hmm.
Thank you.
So let's go back to the contractors. So I have a couple of home care agencies that contract directly with my family members. So technically, that is not, it's not required, correct?
That's what I understand. It has to be who somebody you directly contract with. So, and we discussed this. So like you've got Rocky Mountain Healthcare that comes in with their doctors, their nurses, their PT, their OT. That is a contract with the family. That is not a contract with the facility when you're in a small home. It's not like we have a contract, that the facility has a contract with it. Those are contracts with the specific individuals. So no, they would not be held. We would not have to hold them to the vaccine. That's why it's a good question about the state putting in the National Guard or LPNs or something, because that's a contract they have with the state. We are not paying them. The state is paying them, and the state is putting them in our homes. So I think that's, like Nicole said, I think that's a good question for the state, because we're not contracting with them. The state is to bring them into our homes. So I think that's something we need to find out.
But what's the right part? Because I'm asking for everybody, so we all are in the same page. So for them to come in to our home to provide that care for that individual, I mean, we should be, of course, you're supposed to be checking them in when they first come in, correct? And then you do a rapid? Do we not do a rapid?
They will, I guess a lot of that is going to depend. So I can tell you, when we didn't have rapids when I had the staff, when I had them come in. However, they did disclose to me the group that helps with this placement. And again, I can't emphasize how great they were to work with. They really did make things completely easy for me. They did disclose that these individuals are being tested twice a week with a PCR, because it was before vaccinations, before rapids. So that also, because they knew I was going to get questions from my other staff members, my families, and my clients. So they are very clear. And I didn't have to provide PPE either, as far as surgical masks. They came with their own surgical masks. Now, if they had to fully gown and don and doff, then I was going to have to provide those things. But, you know, again, we would have to really get the information now regarding this new staffing model to see what we're in for. Because it also kind of depended where they got them, right? So I got 2 people from the National Guard and then 2 people from the Army. And so, I mean, it was a little bit different. The Army guys didn't show up with their masks, so we just gave them to them. So it was not a big deal. But they do make it very clear. So I agree with you. I think that if we have more notice going into what we can expect, because when we need them, right? So it would be nice to have those answers before. So we'll definitely ask, because you're right. I mean, but it was not our responsibility to test them. It was not our responsibility. We just had to screen them.
But I'm saying, but I'm also saying, like, direct contractors like OTs, PTs, you know, what does that look like for them? I mean, obviously, we should be providing rapids for these people, even though they're contracted with other families?
No. Unless that's your policy and procedure. And they did say we could choose to do that. If you want to rapid people, you want to rapid visitors, you can, but no, you're not mandated to do any of that. I mean, the way it was explained to me is if I hire someone to come in and cut all the client's hair, I need to make sure that they're vaccinated or religious or medical exemption. If they are vaccinated, I still need to screen them. If we were ever at the point where we were testing vaccinated people again, I would need to make sure that I was testing them appropriately. I need to encourage that they have the booster shot, you know, treat them like an employee. But if Mrs. Jones hires someone independently to come cut her hair, you just screen them. I mean, you might not even know their vaccination status, to be honest with you. So you just kind of treat it like it's a visitor. You screen them, make sure they wear their mask. That's what I was told, at least.
Yeah, that's what I understood in our meeting also.
Mm-hmm.
But I think the thing that's going to be hard to do is in the procedures where it says that anybody that you have that is a direct care worker that is not vaccinated and you're testing them and they're wearing masks, that you want to try to keep them, you know, at the 6-foot social distancing. So
Yeah.
I thought that was pretty much an oxymoron comment, because I mean, they're caregivers. So how are they going to, you know, maintain a 6-foot distance? That just doesn't.
I did clarify that too. And they said that they understand that when they're providing direct care, they need to be within that 6-foot distance. But if they are doing an activity where maybe they don't have to be very close, like calling bingo. So maybe they can be further away if they're calling bingo for the group and they don't have to help check numbers. If they're eating, drinking, or moving their mask, if there's any time they don't have to be in direct contact with the client, they need to be 6 feet away. That's what I was told. And I was like, that's kind of a really slippery, sticky slope, but basically do the best you can is what I was told. And we do need to make sure that we're asking if the unvaccinated staff go into a client's room, we do need to ask the client to wear their mask. Now they can refuse, but we need to encourage that if they're in that personal space of that client, that everybody is masked if possible.
Nicole, where does it say that boosters are mandatory? You said it was in the public health order, but I can't find it.
It's in the brand new public health order, but it's also, Jason posted it. It's also in
chapter 2 of the licensing.
So Jason, did you just post that today?
I can post the direct link.
Yes, please, if you don't mind.
And the other thing that's sticky is I have people that are vaccinated with Pfizer And they're like, I don't want to get my booster shot till Moderna, to the Moderna staff have to get their booster. So, I mean, we're starting to hear all sorts of crazy, and well, not crazy, but creative reasons as to why people don't want to do it. And I agree with them. I mean, again, we're really pushing this whole thing. And like, it would be nice to somewhat allow individuals to take a second to absorb the education and to vet and decide on their own, and give people a minute.
I just wanted to, full disclosure for everybody, I had been on vacation with resident temperature checking. I'm now apparently back on that. So just in case anybody else wasn't doing it, we should be doing it.
We should be screening for COVID every day, all staff, all clients, all visitors, contractors, paid, everybody. It sucks. They're so sick of it.
I'm sorry, on to the regulation that Tara posted. So this is that committee that somebody was mentioning earlier. I didn't know what it was, the ACIP. And could you just clarify me, did they recommend it?
It has not been recommended by them yet. I mean, it's been recommended. It was that whole conversation with the CDC and CMS, and they, like, everyone was fighting back and forth, yes, no, when. Originally they said people over the age of 65, and then like 10 days later, they came out and said frontline workers that are at risk of having complications with COVID should get vaccinated. And then like 5 days later, they came out and said, oh yeah, anybody in a healthcare setting, those over 65, those severely immune compromised, should all go get the booster. And we weren't really privy to those conversations very much, because that was like Good Day Pharmacy was giving us updates. I know Walgreens was sending upgrades to us too, because we had our original vaccination clinic with them. I mean, they were changing their guidance like every 4 or 5 days and couldn't really land on what they were all going to agree on either. And it ultimately came to over 65, severely immune compromised, and frontline workers. So just not healthcare workers, but individuals that work at the grocery store, and anybody that's a frontline worker dealing with the public is encouraged to go get the booster.
Okay, so this actually says that should one be recommended by the ACIP? That's not mandatory.
Correct.
So, I'm sorry, I thought I heard earlier that it was mandatory to do it. So is it or not?
So the health department is saying that it is absolutely mandatory.
And where is that written?
I can't find it. That's why I emailed a question just like Jason.
Okay.
So the way,
And I did that as well last week to the residential strike team and never heard back from them.
Yeah.
and so
So
keep
could
in
you-
mind that the third booster dose, that guidance was issued before the FDA even made a ruling on the booster, and they were preparing to have us set up for the third dose booster for our residents. At no point, though, has the state come out and said it's required. And so we're interpreting the guidance as it is recommended for those over 65 or immunocompromised individuals. Healthcare workers were then added, like Nicole mentioned, like 10 to 15 days after the recommendation. But at this point, I don't know that it's necessarily required. We were required to schedule a booster clinic. And at this point, we've interpreted that as our 65 and older, or our residents that are interested in receiving a booster.
That's good to know, Jason, because my two staff that are refusing it are in their 30s. You know, they don't feel like they're at high risk.
Now, I do know that initially we had some staff within our organization that were under 65 that wanted the booster. And the state did give us guidance on that. Initially, they said, no, it wasn't recommended. But after the CDC and FDA issued guidance, they did include those as healthcare workers that if they were interested in receiving it, they were allowed under the new guidance. But at this point, I haven't heard anything from the state that says it's required.
You know what, there's some more information The Healthcare Interactive site did publish something on Wednesday, September 29th on the state extends public health order 2020 booster vaccine clinics required before the end of October.
Right,
So
and that was, and they issued that guidance before the third dose was even FDA approved. And so we were already
this
preparing.
was Wednesday, September 29th is when this was publicized.
Yeah. And
Now, does that say for residents or does that also include staff? Because I felt like that was very vague too. It says we have to set up a booster clinic. Okay, well.
By October
setting up a
1st,
clinic.
yeah.
Yeah, so I'm setting up a clinic. However, does it say that I have to, I open it up to individuals that want to get a booster, both residents and staff? Does it say it's mandatory?
Here's what it says. It says, here is a brief summary of changes to the PHO 2020. Adds a paragraph requiring that nursing homes, assisted living residents, intermediate care facilities, and group homes that have individuals who are eligible for a booster shot complete a COVID-19 booster shot vaccination clinic no later than October 25th, 2021, and schedule this clinic no later than October 1st, 2021. So it says who is eligible.
I'm
Nicole,
emailing
could you-
Peter Myers. I'm just going to email Peter Myers and get a
good.
direct answer.
Good idea, Janelle.
That's what I did. I just emailed him right now. So if I
Let
get-
me look up the CDC of who's approved for boosters.
Because so I know frontline workers are approved, but it doesn't say anything about them mandatorily having to receive it.
Well, the guidance says who's approved is now mandated, is the way I'm reading that.
I think that's where it gets sticky, but I emailed the strike force too, and I haven't heard anything back. And they just canceled, just in case any of you know, they just canceled our long-term care meeting for tomorrow. So I'm telling you, they're working on something big. They're not working on something little. I really think there's some sort of change going on with all this vaccine mandate stuff, honestly.
Okay, here's what the CDC guideline says. It says CDC now recommends that people aged 65 and older or residents aged 18 and older in long-term care facilities should be getting the vaccine.
So,
It specifically says residents.
yeah,
Those residents, yeah.
so
Right.
so it's not mandatory for
So it
employees.
says this is updated October 4th, 2020. Key things to know about COVID-19 vaccines. This is off the CDC website.
However, if you look in the chat, Tara just posted that she heard back from the strike force and they said the public health order 2020 seen above is the amendment for the booster. So she basically.
But it doesn't really specify that.
Requiring that nursing homes, assisted living residences, immediate care facilities, and group homes that have individuals who are eligible for a booster shot complete a COVID-19 booster shot vaccination clinic. I agree. It doesn't say anything about staff.
Oh, no, it does. It does. It says what to know. COVID-19 boosters shot are available for the following: 65 and older, 18 and older who live in long-term care facilities, 18 and older that have underlying medical conditions, 18 or older that work in high-risk settings.
Okay.
But your
This is
key
Eileen.
word there,
This is
Janelle,
Eileen, you guys.
the key
Stop.
word,
You
Janelle, is
guys. Go to 12.2.1, which is the new emergency rules. It's very clear that all employees, direct contractors, and support staff have received their first dose of COVID-19 by September 30th, the second by October 23rd, and all employees, direct contractors, and support staff must take a subsequent or booster vaccine should one be recommended by the Advisory Committee on Immunization Practice, which is the CDC's advisory committee, in accordance with the recommended timelines. It's all there, you guys.
but there you go. Once again, it's the ACIP.
The ACIP basically is the group that recommends to CDC.
And I think
I
that's
think
the
it's-
question.
And then the next one says an employee, direct contractor, support staff who was diagnosed, received monoclonal antibody or convalescent plasma. Okay. and on or after October 31, all new employees, direct contractors, or support staff shall have obtained full COVID. I think that that's their attempt to make sure that all staff have it, you guys.
I think so too, because it says if you work in a high risk industry, and I think ours is considered high risk industry.
Yeah. Sorry, but I think you've got your answer there.
Yeah, I agree with Eileen. I think it's pretty clear when you read the CDC, we're in a high risk industry.
Yeah. I don't think you're going to get out of this one.
I don't think so either. Yeah.
And I hate to say that some of you probably will lose staff.
So I wonder what happens if they've gotten both of them. So I've got 2 young girls that work in one of the facilities I work with that have gotten it, and they really don't want to take the third one. They want to wait. They feel that they're healthy. They just want to wait. And so one of them approached me and said that she had heard that you could get it as early as 6 months, but the longer that you waited to get it, the more effective it was going to be. So has anybody heard that?
No, I haven't, Janelle. I think it says that I don't think it gives them a choice. If they're not exempted out for religious reasons, I think they're on the train that they should be vaccinated within 6 months of their second dose.
So if the 6 months, so if it's not within the 6 months, so the October date cannot be facilitated. So you'll just have to keep track.
Exactly.
And,
Or they have to-
what 12.2.1.c says is in accordance with the recommended timelines. So you do have people probably who it hasn't been 6 months, or you might.
Eileen, what did you cite? What was the 12?
It's 12.2.1. Whoever put this in it's in chapter 2 of the
Okay.
rules that the health department passed a couple weeks ago. Now this is going to the full board for approval, for final approval. So there may be some tweaks, and I haven't looked to see if they have issued a new draft, but some of you were on those meetings a week or 2 ago. There were 2 of them, and they were collecting information for revisions to this draft. So I don't know what they've actually put in a revised draft, or if we've seen it. Nicole, that may be what they're working on in your residential strike force.
Eileen, they probably took all those comments that were there that day, hopefully, right?
Yeah, and put them in the trash.
Yes.
Eileen, do you have any guidance? Because Representative Valdez was on the call. Do you have any guidance as to why he felt like today would be a good reason to hop on, and if there is anything that those of us on the call can do to plead our case for support in many different ways?
I honestly don't. In the middle of this call, Senator Janal called me, and I said he was on this call, and she gives your apologies for missing it. She's in Arizona today. But she said he's running for Senate. So she thought that might be why he was trying to just get some basic information. So I don't know, but I made a note to try to reach out to him. So I think we should do that through the GERC.
Well, and I think a lot of us need to point out our cases and some of the difficulties we've had along this process, and how we are doing, just the trouble, the tribulations throughout this entire process. I think he needs to be aware of that.
Yeah, I don't know what his interest is, and I don't know if he's planning to run a bill. I think we're going to be inundated with bills for assisted living this next time around.
I agree. Does anybody, Eileen, do you have anything else for the group that you feel like it's important for all of us to know? And then we'll open it up more too for the 25 amazing members and participants still on the call.
Just congratulations to all of you who have continued to try to fight this battle, and who have been able to, weather it. I'm not sure what we can do. I will say, Nicole, that Senator Janal was wants to get together probably the second week of November to talk about the bill that we had last year. So if you want to recruit some additional people to be a part of maybe a brainstorming in advance of that, just take everything kind of off the table that we had last year and sort of talk about what makes sense, and just kind of do a wish list. Might make some sense, because then it can be kind of a brainstorming, get everybody's ideas on the table, and then we can maybe present what we could get through, because she's real concerned about being able to get things through. So she might pare it down really hard, but at least we get people's ideas on the table. So if you want to do that, that would be great.
Excellent. So everybody watch your emails. We'll start to send out emails to recruit individuals that are excited about being part of the brainstorming. Just to recap, CALA does want to run a bill this session that will separate the small residential assisted livings possibly from the regulations from the larges, and just kind of see what we can do to support the industry as a whole. So watch your emails. The Government Relations Committee will be sending those out, and we definitely want so much interaction from the membership as much as possible. And those that are non-members, we want all of you to be part of the industry. I can say passionately, and I know the question was asked earlier, and then I promise I'll open it up again for questions just to honor everyone's time. But one of the benefits of CALA is we do have people like Eileen in our corner and on our board that really do support us in contacting legislators and really trying to get the ball moving in ways to advocate and support all of us. Furthermore, as we all know, to get anything done and support legislatively, we need a lobbyist. So, you know, we don't have a lobbyist right now. We've been using the talents of individuals that know how to work that system. But the bottom line is if we really want our voice to be heard, we really do need a lobbyist that can advocate for us and who can listen to our guidance and support us so that we can get our bills initiatives and be heard. So that's one of the things your membership does go to. We are rebuilding financially CALA, like we openly say several times. And we've been trying to create an essay to really get a good, strong, passionate lobbyist that will support us in our our initiatives. So that's one of the things of why it's so important to be a member of CALA. And then, does anybody else have any comments, concerns, questions? Again, Janelle and I would love questions to email to the health department and the strike force, because Peter is part of those calls. Does anybody else have anything else?
Nicole, this is Janet. Do you think we should do a follow-up to this? It seems to be pretty pertinent information. Wonder if CALA needs to do a follow-up call next week.
That would be great, especially since the state canceled theirs.
Yeah, I'm thinking that we're all flailing with no information. So maybe a key group of us can get solid information, and then we can, have another Tuesday talk if everybody wants to next Tuesday.
And we could even make it shorter, like 15 minutes to 30 minutes, and just update regarding questions maybe we have gotten answers from the health department, from the strike force, from the staffing group that is helping with staffing. And again, we want to hear if people are closing their doors. We want to hear about the loss of Medicaid beds. We really, really want to keep track of that as well.
Or Nicole.
Yeah.
We have a meeting, or there's a meeting next week as well with Senator Kolker on Monday. I sent some of you an invitation, but I would suggest that it's from 9 to 11. If anybody's interested, I'll be happy to forward you the Zoom link. Because, if we could get 10 or 15 people who have some time to do that, that would be great too, because I don't know what he's trying to do, but I talked to his legislative aide and he was very vague, but he wants to run a bill on assisted living. That's as much as I know. So if anybody wants to be involved with that meeting, I sent it to you, Nicole. I sent it to you, Janet. I think I sent it to Peter, and I sent it to you, Rachel. I did not send it to you, Janelle. I'm not sure why, but I didn't. So I'll do that here in a minute.
I'm planning to attend that, Eileen. I got plenty
Okay.
of time next week, so I'm planning to attend.
Okay. So
I'll forward that to anybody who needs it, like Janelle or anybody interested in joining us next week.
Yeah. So, okay.
Well, I do want to honor everyone's time. And I want everyone to know that we appreciate you, that thank you so much for sticking through with not only serving your residents and supporting your staff, but also being an important part of CALA and for your continued support. We really do appreciate it. Please let us know if there's something more we can be doing. Thank you for all of you that reached out in the chat. I will be following up with you as well, the rest of the board. And just stay tight to your emails, and we will see what type of information we can get out to you guys to answer some of these questions next week.
All right.
Thank you, everybody.